Thank you, everyone, for joining me. I'm really excited about today's interview. I'm going to be interviewing Juli-A Morning. I'll give her an opportunity to introduce herself. But first, I'd like to tell you that I'm Tanikka Price. I am the Chief Education and Equity Officer at Health Impact Ohio, and I help to run the Central Ohio Pathways Hub CHW certification program. So, really excited about this interview today. You'll find out why as we get more into this. So, would you please introduce yourself and let us know the agency that you work for?
I'm Juli-A Morning. I'm with United Church Homes. Got the little merch we're gonna wrap today.
Cute.
I came in through the CHW um, internship program, Pathways, and went through my internship, and now I got hired on with United Church Homes.
Awesome. So, let's start with what inspired you to be a community health worker?
Okay, so I think now that I'm here, I think I always was one because like I'm a good listener. I'm always that person at the bus stop. People, just random people, come up and tell me their problems, and people have something they need. I love to help people, but I want to say it was 2015, and Dr. Gabby had talked about CHWs and the benefit in the community, but I could never find the right combination of childcare and availability to go and do the classes, and just completely separately. All these years later, I was in Proud Linden parenting group, and Latoya Matthews came in talking about a CHW opportunity, and here I am, and it worked out.
Awesome. And you talked a little bit about Dr. Gabby. Would you mind talking about the time that you spent in the Moms to Be program? That's actually where we met.
Absolutely. I met Dr. Gabby and everybody, Tanikka, a few other people, when I was in Moms to Be in 2015, 16. At the time, I was homeless and pregnant, and that program really, really helped me personally, emotionally, getting everything ready for my baby. I ended up in a much better place than what I could have imagined because of that availability of that program and the supports that we had in that program. So that's a plug. Anybody get pregnant, y'all go to Moms to Be.
Thank you. Now, tell me a little bit about how your background, how being pregnant, being homeless, how has that affected your ability to reach your clients and be a CHW?
I think for me, it's a mental position of non-judgmental and understanding that most people have a way of doing things. There's a status quo, what is meant to be a priority. But my background is inform my priorities. For instance, buying a house for most people is more important than buying a car. But having been homeless twice, knowing the importance of a car, my priority might not be your priority. So in my position, what I come into a situation think is the priority that needs to be taken care of right now today, that might not be their priority. And oftentimes it is not. I might think your immediate need is housing. You need to get out of here. But you feel like the immediate need is you want 2 more hours a week for your aid. Okay. That's the priority for you. I can't do this for you. And so my past has, I think, put me in a position to be more available to understand other people's priorities and the way that they're thinking, what's more important to me, because I don't know your system. I don't know your timeline.
Now, one thing I remember from your time at Moms to Be, I remember you being at a point of being hopeless. And then I remember that hope and that joy and that belief that you would be okay being restored. Can you share a little bit with us about what that process was like, going from being pregnant and hopeless and homeless to having that joy and that hope and that home for your children?
It's it wasn't a moment. It was a process. It was definitely a process. Um, Having so much support and having the constant reassurance that it's going to be okay on days when I didn't think it was going to be okay. I truly believed it was not going to be okay. And somebody said it's going to be okay. And having people ask questions. I remember once you asked me what were my goals, and I listed off things for my kids. No, what are your goals? It had never in my 30 plus years dawned on me that I was allowed to have goals that didn't have anything to do with my children. just putting people in a mindset. I think that really helped put me in a mindset that if I can think about it, it can happen. And at that time, I really just wanted to be the best mother to my newborn. And I didn't know, I didn't see it happening. Like I honestly did not know how that was going to happen. But I ended up in a position, housed, everything on, crib, diapers, car, like ready to go. And no, moms be the only people who came to see me in the hospital. I mean, it's little things like that people don't think about. Just being there for somebody can really make a big difference.
And I'm getting teary-eyed because we cried tears of sorrow together. We cried tears of, anger together. And then we cried tears of excitement and happiness together. And so to see you where you are today, it just really fills my heart. Talk about the way that you think your work now as a CHW. How does your work impact your community? Being able to give back, what does that mean to you?
It means everything to me, especially with the clients that I'm working with. I'm working with seniors. We're all going to be there if we will, God willing, we will get there. And so everyone has a mom, everyone has a grandma. And so I feel like learning what I'm able to learn, what I'm helping these clients is helping me learn how to help other seniors. This is really important what they're doing here. I mean, so I think it's really impactful for everyone because we're all going to grow. God willing, of course, we're going to get old. And these are things that we need to know. And we can fight like for more money and regulations that'll help protect seniors because it's going to protect us. So I mean, I think what we're doing here is benefiting the future. We're helping people now, but the help that we're helping people now is going to benefit us in the future and other people in the future.
Now, rarely do you see somebody who has homelessness as their only issue. Can you talk a little bit about the kinds of issues that you see going along with homelessness, and maybe give me an example of somebody that you've been able to connect to multiple resources and services?
Well, with homelessness, that's a symptom. So normally with homelessness, people have chronic conditions that I'm working with or that I've encountered. Um, medication management, medical referrals. Um, when your life is in shambles, you're not thinking about your health. So scheduling appointments, keeping up appointments, where's the doctor's number, social services, getting connected to food, transportation, talking to the waiver counselor for, well, the waiver, what is a case manager about what we're gonna do about the aid. Do they have waiver hours to, be transported to do this activity that they need to do to move? Because medical transportation doesn't do that. A million other things that go with housing. Housing's like the hardest one on the list, but it's never the only one. That's not. Yeah, it's not the only one.
It's never the only one, right?
Mental health, mental health, along with housing.
Hmm.
Yeah, but I think from what I've experienced, there's before the homelessness, there was an event, whether it was a health event or a financial event, but there was some type of event that happened. And so there's going to be a mental health component going along with the homelessness.
Now, obviously, we're on Zoom, right? We're on Zoom because of COVID and because of the pandemic and the ways that it has changed our lives and changed our workflows. Talk a little bit about how you see COVID impacting your clients and how your clients have responded to you advocating for the COVID vaccine.
My clients are great about the vaccine. They're all vaccinated. Everyone's vaccinated. We talk about boosters. They're already on it. Um, the only real thing I've had to talk about COVID is ventilation. I wasn't really aware of the ventilation aspect because I've got clients who get COVID a lot, who have had COVID twice a year since it started because they have lots of guests. So we're talking about, okay, well, we can't social distance because you're in the small apartment. What can we do? We can ventilate. You can go get tested after you have these events. But a lot of people are afraid because seniors seniors with chronic conditions, anyone with chronic condition and seniors already are more susceptible to getting COVID in a bad way. So it's a really scary thing. And I mean, in our building, people get COVID all the time. And I mean, the sanitizing and you can preach social distancing and everyone's cool with it. There's some people who will not wear a mask. They don't feel like it works. But other than that, I think my people have been really good about it, other than the social distancing.
Well, listen, my last question to you is if there's anybody who's in a situation that you've been in, whether it's homeless, whether it's pregnant without support, whether it's trying to figure out what the next step is and not having any personal goals, if they have the heart to serve, what would you tell them about this journey that you've taken? What would you suggest to them to take advantage of?
I would say take advantage of any free resource that allows you to meet people because that having a support system is paramount to overcoming things. You can have the money, but if you feel bad, you're not going to get through it. It's just but if you have a heart to serve, get out there and do it. There's a million ways to serve. This situation with the CHW happened to be right for me, but maybe your thing is feeding people. Find where you can serve that way and you can meet people that way. Even if you're down and out, find a place that you could be of service because that'll help you, I think, feel better. And you can meet people that can help you, better your situation.
When I think of you, Julia, I think of sacrifice because you've always made sacrifices for the people that you love, for your children, and even for yourself to have a better life. And I hope that you can see that those sacrifices are paying off.
Absolutely.
Thank you for your time.
Absolutely. Thanks for having me.